And now to a troubling report about how the virus is disproportionately impacting pregnant women in the Latino community. What explains this disparity? ABC's Stephanie Ramos takes a closer look.
Honestly, my world ended there.
At 37 weeks pregnant, Stephanie Ramos found out she tested positive for COVID-19.
When I got the call, they told me, "Oh my God, you're positive." I was crying. I was like, "Oh my God, my baby, is he okay?"
She says carrying her baby to term was her priority.
I was, I don't know, really scared. What am I going to do? I was going crazy, you know?
Stephanie is among the growing number of pregnant Latinas infected with the coronavirus, a group disproportionately hard hit. The CDC says it knows of nearly 13,000 pregnant women in the U.S. who have tested positive for the virus. Latina women account for more than 5,000 of those cases, nearly 40%. And overall, Latinos account for nearly 33% of COVID-19 cases in America, despite representing about 18% of the population. For Stephanie, she says it could be her environment. Both her parents work in the restaurant business. Many of her family members, including her husband, tested positive for the virus as well, despite saying they took precautions to stay safe. Stephanie gave birth to a healthy baby boy in April without any complications. He was tested for COVID-19. The result? Negative. She's now recovered and at home with her baby. But sadly, not every case has a happy ending.
Just devastated, just trying to stay strong for my kids.
In Brooklyn Center, Minnesota, Juan Duran Gutierrez's wife, Aurora, started to feel COVID symptoms in June. She was coughing, she was having trouble breathing, but her COVID test was negative.
Doctor told her that sometimes tests are inaccurate. Told her to just stay home.
His wife's symptoms taking a turn for the worse. She was admitted to the hospital at 29 weeks pregnant, placed on a ventilator, and delivered her baby prematurely via C-section. 5 days later, Aurora died. Juan says her oxygen levels were low, possibly due to COVID.
My 7-year-old girl, she's having a hard time processing it. She cries a lot at night, asks a lot of questions at night. During the day, she's just quiet. She won't even talk. She's having a hard time processing it.
He now relies on family for support as their baby recovers in the NICU, while at the same time, they mourn the loss of Aurora.
Everybody's doing video.
These are the fears hanging over expecting parents Valerie Fuentes and her husband Andy in Miami, a city where COVID cases have soared the last few weeks.
What went through your mind? You're finding out that you're pregnant, and now there's this virus that the country needs to tackle.
Definitely fear. There still is. I still am scared to who I'm going to be exposed to, where were they last. We refuse to go to the grocery store. Like, we still Instacart everything. So just being super cautious, just because now we have to take care of a baby. It's not just about us anymore.
Valerie learned she was pregnant the last week of January. Her husband hasn't been able to go to the doctor's appointments with her, so she FaceTimes him in. They have also avoided seeing family, many of them contracting the virus, even losing their lives to it.
We just actually attended my grandfather's funeral burial yesterday. He was diagnosed with COVID. He was tested positive, and then a week and a half after that, he passed away.
His 2 aunts had COVID. His grandma has COVID. His uncle has COVID. His cousin has COVID. So it kind of spread within that one unit of household.
The couple says they find it difficult to stay away from family, but are taking every step necessary to stay safe as they await their new baby.
I think just as a culture, Latinos are very, family oriented. They want to gather, they want to celebrate. And I think having those kinds of gatherings has really helped propel the spread.
But doctors say it's important to remember that most healthy young women will survive the virus if caught early, and pregnant women should continue seeing their providers.
The good news is that, our patients who are young and healthy, pregnant, the little ones, they're faring well. And so while not every single person you can guarantee that to, on a whole, when you look at the limited number of data, case studies, case reports, is reassuring.
Stephanie Ramos, ABC News, New York.
Our thanks to Stephanie.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.